Hey, good evening, everybody. Good evening. Can you hear me? If you can hear me, just put in the chat box that you can hear me with an emoji or anything. So, welcome to another live session. Oh, thank you so much, Miss Mary Jane. Thank you so much. So, welcome to another live session with EMGS on interview preparation. And I could see on the group where I asked that what interview are you having? And I could see lots of interview. And this is there everybody out there that are thinking that interview is not possible, thinking that people are not getting jobs, or thinking that NHS is not working anymore, or thinking people that pass through self-sponsorship process for nurses that it's not working anymore. Say that people are getting interviews, people are getting jobs. I know it's not as before, but people are still getting as much jobs as possible. Just want to put it out there. And today's interview preparation is to guide everybody, right? And you can see, if you're here, you can see that more than 10 people posted interviews on the group. You can see that I think you guys are up to like 15 or so that is with different hospitals. And that's say that in as much as we do a group interview sessions today, you might still benefit from having a one-to-one personal interview whereby your interviewer can help you personally and listen to you say it repeatedly. Because one thing you must know about interviews is that once you keep talking, once you keep saying something, you just get used to it. And when you now start going for the interview, the real interview itself, and you're being asked a question, I tell you, you will not be scared to speak because it's already what you practice, right? With your one-to-one interviewer. So EMGS offers one-to-one interview session, right? So all you need to do is to reach out to us and then we'll support you with that interview. Now, one thing we also do is to get past questions and do what and post on our groups. Now, why do we do this past question? A lot of people, right, in as much as they prep for interview, if they see a past question to guide them, they will become more confident. You understand? And it will give them an insight to where they are going to prepare for. Imagine now you are reading towards deteriorating patients and then your interview comes up on safeguarding and you've not even seen maybe a glance of interview question that talks about safeguarding, you'll probably be thrown off balance. But joining our interview preparation group, which is free, and interview past question group, as I meant on Telegram, which is free of charge, you just join and then you see where people post past questions. You'll be able to learn better. And also to everyone here on this Zoom call today, um, once you've passed the interview, we are pleading with you to please put out your questions. Now, this is not just to help any other person, right? It could be your sister today, it could be your brother tomorrow that is probably having their interview, and this could guide them. And let's say, God forbid you do not pass your interview. Um, you could, once you've written, because after you've had an interview today, you just forget about the question the next day, you understand? But once it's written down and somewhere, it's kept somewhere, let's say it's kept, you give it to us and put it in our group, you can always go back to read and refresh. And who knows, that question could be the thing that will make you get your next job interview. But that does not mean that you won't get this interview that we're preparing you for today. We really, really hope you get your interview and pray you get that job and smash it. Okay. So my name is Stella and I am one of EMGS team members and I'll be hosting your interview today. So welcome to this interview session. So I would like you to introduce yourself, and because we are live, I do not want you to mention your full name for your confidential purpose. I would like you to say if your name is Sarah Adeleke, you just say Amnos SA. You understand? Just to protect your like privacy and all of that, because we really respect privacy. So tell us your name, tell us the hospital that you are interviewing for, tell us yeah, and then the job role exactly. So just that's all, just three of them: your name, the hospital you're interviewing for, and the job role. Quick one. And once you're done speaking, please mute your mic back so that we don't get background noises. Thank you so much. So anybody, just quick. I can see we are like 17 on here. Anybody, quick. Be bold.
Hello, I'm
Hello.
P. I'm PA and I'm interviewing at Wigan Teaching Hospital for the position of a registered nurse.
Thank you, Mr. PA.
My name is Okay, I'm actually preparing for interview with Northern Country and do NHS Trust for a stroke ward. Thank you.
Okay, nice to hear from you as well.
Good evening. My name is
Good evening.
Tawakkalt. I'm actually preparing for Band 5 mental health nurse role with Northern Highland and Live West Southwest. Thank you.
Thank you as well. So, thank you.
Good evening. I'm
Good
MA
evening.
and I'm currently preparing for interview for a Band 5 role with University Hospital Mockland for a role of registered nurse in a general medicine department.
Okay, nice to hear from you as well.
Good evening. My
Good
name is
evening.
Nurse EA. I'm preparing for a role of research nurse and practitioner at University Hospital Plymouth. Thank you.
Okay, thank you. Let's have others speak. Let's have, yeah, go on.
I'm Nurse ED. I'm currently preparing for an interview with Bath Health NHS for a nursing
Okay.
role at the cardiology unit.
All right. Thank you so much.
Hello, good evening.
Good
I'm Nurse
evening.
AO. I'm currently
Yeah.
preparing for an interview for older adults. I'm a general nurse.
Okay. Nice to meet you.
Hi, I am Nurse
Hi.
AN. I'm interviewing with University Hospital Wishaw, that's NHS Lanarkshire, surgical slash trauma as a registered adult nurse.
Nice to hear from you.
Hi, good evening. I'm Ness AJ. I am interviewing with NHS Lanarkshire Wishaw University Hospital for the role of a general medicine for a Band 5 nurse role within the general medicine department. Thank you.
Okay. Nice to hear from you as well.
Good evening.
Good evening.
My name is Nurse DU, and I've got an interview with East of England Ambulance Service, and I'm applying for and I applied for the role of the clinical advisor.
Okay. Nice to meet you.
Good evening. My name is
Good
Rita,
evening.
and
Okay. So,
I'm an adult nurse that apply. I applied for the role of Band 5 nurse. I have the interviews with Birmingham for the role of the gynae assessment unit. Then in Northern Ireland, I have about two interviews: the community treatment nurse and the sexual health nurse. Then I have with Northumbria palliative care and the other one. I have about six interviews now.
Now you're the one that just getting all the interview.
I don't even know.
Nice to hear from you.
Thank you.
So I believe we're all done now. Okay, so thank you so much. Thank you so much for introducing yourself.
Good
Now,
evening.
okay, someone is still speaking. Okay, carry on.
Good evening. My name is
Good
Nurse
evening.
Chicken. I have an interview with Site and Globes of Integrated NHS, the role of Band 5 adult nurse
Okay,
in acute medical unit. Thank you.
AMU. Okay, all right.
Yeah.
Nice to hear from you.
All right, good evening, all. My name is Nurse Vincent Abi. So I have a Bansis nurse interview with NHS Lothian in Scotland.
Okay, nice to hear from you.
Thank you.
hi, good evening.
Hi, good evening.
My name is Joy. I've got an interview with Hampshire NHS Trust as an adult nurse on
Okay.
as an adult nurse on 9th of March. That's tomorrow.
Oh, okay.
Yeah. So I've also got another one on Tuesday at Northumbria as an adult nurse as well.
Okay. Wish you
Thank you.
success.
Thank you.
Nice to hear from you. All right. So I think that's all. Thank you all for introducing yourself once again. So who can tell me, just shout it out, what are the do's and don'ts in preparing for an interview? I'm talking about, let's start with the basics now, right? We're not going deep yet. Let's start with the basics. So how do you prep yourself for an interview? Physically, environment, in case it's virtual, you're having it, or even if it's a you're going one to one. What are your prepping strategies? How do you get yourself ready for an interview? Shout it out.
If it's for virtual, I think you should ensure that your phone is fully charged and that you have a good lightning and a good background. So that's what I think. And you have a
Okay.
good network.
That's the correct and well done. Thank you so much. So who else or other thing?
Basically, what I do is after getting the interview, I try to book a slot for the time and the date of my interview. Then I'll go through my job application to see my application, what I put in there. I'll go through the job specification and job description. Then if it's virtual, I'm going to if it is virtual, I'm going to communicate with the team lead or the manager for a link for the interview. And if it is physical, I'm going to search about the location, try to book my ticket for the journey, then start reading the job description and person specification. So that's what I do. I'll read about the trust as well. Thank you.
Okay. Well done. Who else? Thank you so much. You're all saying the right thing. So, because this is just basics, I'm sure most of us know. So, I don't want to start going into it. So, I want you to shout it out. Yeah. So, what else?
Good evening. And for
Good
my
evening.
own, um, when I have an interview, what I normally do is I'll familiarize myself with the role I applied for. After that, then I'll a kind of do an informal visit to the hospital, basically the unit, and I'll look for someone to ask some questions based on what they do in that very unit, how is the interview questions like, and all that. Then after that, I'll return home and I'll begin my preparation based on that and also ask questions. I also go to Google, check online related interview questions and all that. And on the day of the interview, I will ensure I arrive early, yes, to get myself fully ready for the interview. Thank you.
Thank you so much. Well done for that. And that's a good one. It's always good if you can pay an informal visit, especially for roles that are band six, band sevens, and band eight roles. If you can pay an informal visit, it goes a long way. Also, some people will feel like, okay, maybe it might be a negative thing. What if they see me and they'll be like, oh, I don't like this type of person, be a nice type of person from this country or this race or something like that. But if you look at the positive part of it, right, it outweighs more than the other side you get. And they've already given you the interview, by the way. It's not because they see you now and they will not give it to you, right? If you go to the interview and smash it, it's not only one person that interviews you on that day, it's two or three panels. So it's kind of gives you an edge. And then when the person, oh, you even came to visit and all of that, it really makes sense, right? Another thing you can do if you can't pay formal visits is to send an email. Could you please give me a brief idea on the board and everything? I've got an interview, so I could have, so just like type a little bit of the message. And normally they always send, if you look at your job description, right, you will see a message at the bottom or the job advert. So you say for informal calls or informal visits, message this person. So they already expect, like they're expectant that some people do such thing, right? Because interview is a two-way thing. It's not just the fact that you are applying, it's also because they need you as well too, right? So they need you. So they need you to come and see, okay, is this thing what I'm looking for? It's not when they invest in you, training you and all of that, within the next 3 months you are leaving. It's a waste of resources on their own end because then they are now short again, and they're going back to advert, and putting out advert, all of that costs the hospital money. So, and that's why it's very important, money and time as well too. So it's very important that if you can, if you can't, it's fine, because of distance alone, especially like I said, for 6, 7, 8, 9 rows, those band rows, it's very important you do. Or if you can't send an email, you can give a call, right? There's always a phone number to call. So like, can you give me a little bit introduction about your words and all of that? So that really makes it all about the role, not necessarily words, because there are so many job roles here that are not necessarily word based, right? Okay, so that's that. Who else can give me just one more person, and then we're done with this bit? Anything that they've not said before that you would like to say? Okay, right. So no one is speaking. That's fine. So that means everyone has said everything. So if you're going for an interview, just like everyone has said, right, you need to prep ahead. You look at the job description, look at what you've reviewed, what you've submitted, right, in your interview questions and all of that. What have you submitted? Look at the person specification, especially the essential part and also part of the desirable. You look for the trust values. You can check a CQC to look at parts of what the last CQC the trust had, or the hospital had, or the job had. What was their CQC rating, or what was their quality rating, and what part are they looking at to develop? Look at also, they'll also tell you their future goals. If you look at their if you look at around the job description, those places I say download questions, you look at where they are showing their future goals. Some will tell you they want to be more tech, some will tell you they want to be more research based, and then think, how can you contribute, right? And this could also help. And you can also kind of once in a while, not all the time, just chip it in your interview, and that goes a long way, right? Another thing you can do if you're preparing virtually is to make sure that your background is quiet, right? As much as you can, it's quiet, right? Another thing you can do is to make sure that you've got good internet, your phone is charged. It's not when you are prepping for interview and then you're like, oh, I want to go and charge my phone, just give me 1 minute. I mean, they won't say, oh, it's human thing, but somehow, yeah, having an interview against thousands of people, or like 3, 10, 15 people, and it's always good to be prepped ahead. And especially if your phone just goes down or something, you lose your stability, and before you get yourself back for the next question, you might not even know where you were before, right? So it's very important that you prep yourself ahead of time when you've got interview coming up, right? And if you're going physically, you look good, right? Try to look good. Don't look haphazard. Even if I know somebody, right, when they were going for an interview, so what they did was they took a train, and the train they took, they had to sleep over on the train, right? And then they got the train got to the place they were going to the next day, the morning of the interview. So the person had to quickly rush into a shop, and then do a quick fresh up, like clean their face, wash their teeth, and all of that. So, and spray up some perfume so they could look good right after they've slept in the train. So it's very important that you look good, you look presentable, and look smart. Also, do not try to change your tone. Do not try to form phonetics or anything. Just try to be yourself. You've prepped ahead of this interview. It's very important that you just go and speak. And it's okay to be scared. Let nobody tell you that. Don't be scared and all of that. No, in an interview, obviously you'll be scared because you don't know what the outcome will be. But ask yourself, what's the worst that can happen? Right? What's the worst that can happen? Will it kill you? No. So you just go, do your best, and then just come out of it, right? Just do your best. Give it your shot. Think about, what if someone say, I will give you 1 million naira, or I will give you 1 million pounds. All I just need to do is to tell me you are worth it. And then just go and prove to them that you are worth it. Now, what some people do not do is they don't sleep. You need to sleep before your interview. That person that is having an interview tomorrow, after this interview session, go and sleep. Okay, once you need to sleep and rest your head. It's not around 1 a.m. or 2 a.m. or 3 a.m. or 4 a.m. in the morning that you are still trying to, oh, what was the last page? What was the last page? Fana. Who even told you that it's that thing that you are doing that will come out? I had an interview one day, and 4 a.m. I'm still prepping. Even when I was driving to the work, I was still opening the book to check. At the end of the day, nothing nothing came out. Nothing of all those sorts. These are just 2 questions interview, right? But then that has already threw me off balance. How was that? Because I didn't sleep. My head is disorientated. I just went for the interview. Obviously, I won't get that kind of job now, right? So it's just taught me over time. The next interview I had, I slept and I got the job. So it's very important that you have to rest your brain, because this brain, it has time, it works. Don't overwork it. Okay. So it's very important that is put into place. Okay. So that's the do's and don'ts of interview, prepping yourself ahead. Now I've gone through you all rules, right? And I can see that some are around maternity assessment units, some are around surgical and trauma, some is on cardiology, some are around general medicine, involving care for older adults, around cath lab or cardiac area, right? And all of this, right, all of these rules, one thing that they are connected with is that you have to know some certain things. I cannot probably go in depth, like specific too much, in as much as I will still try to be as specific I can today. But what is the basic thing that everybody must know based on all these rules? What general rule must you know, right? Based on all these different interviews that you are having, what is a must know? Number one is caring for a deteriorating patient. Someone that is a maternity assessment unit, how will you be able to recognize a pregnant woman that is deteriorating? How will you be able to assess someone that is having early signs of pregnancy issues, complications, right? Someone that is in cardiology, how do you recognize a cardiac patient that is deteriorating? Right? Someone that is in general medicine, how will you recognize signs of deterioration and what will you do when that happens? I forgot one, and community roles as well. So I noted we have some community roles, and also we have some is it ED role now, the one that has to do with calling people, right? Like 111's assessment, phone assessment, and all of that. But they are still all related. They still cover all these bits, right? So someone that calls you, oh, okay, you're doing a phone assessment with somebody, and the person say, oh, my son is choking at the moment. Oh, and then you'll be asking the question, okay, so what color is he now? Okay, what did he eat last? Okay, where were him? How long has he been down? How can you recognize via a phone call signs of deterioration? In cardiology, how can you recognize that? In community, when you go and visit somebody in their house, how will you know, right, that this person is not looking so good? What are the signs and symptoms? And when you eventually recognize this, what is your next step? What actions will you take? Okay, so it's very important that all of these are being looked into. Another thing that I want you guys to also try and look into is knowing what are your A to E assessments, right? In terms of which area of specialty you are, what are your A to E assessments? Another thing you need to do is escalation. What is your process of escalating? Now, escalation is not necessarily only having to do with a patient's deterioration. If you note someone that needs safeguarding, how do you escalate that? If there is conflict, how do you escalate that? If you notice miss error, how do you escalate that? Someone that is in research area, right? Someone that's preparing for a research program, as you are administering the research drug, right? Or you notice one of your other nurse has kind of made a mistake in administering the wrong research drug, right? How do you escalate it? If there is a conflict between another nurse and a patient, how do you escalate it? So it's very important. Another thing you need to also know, which I've just spoken about, is conflict management as well too. Okay, how do you manage conflicts within patients, between patients and yourself, between two staff? How do you manage all of this? For someone that is doing phone assessment, how do you manage conflict with someone that just call you and say, "Oh, you motherfucker, blah 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 blah. You serious? Get away!" Shouting on you, and you're giving the person like you're yet to give the person help. How do you manage such conflicts? Okay. Now, another thing I've talked about safeguarding, right? So there are some things you need to know in regards to all of this. And most importantly, when you're talking about all of this, you have to put into consideration patient safety. In all, patient safety is still priority. Okay. Now, when you have a new score of 5, when you have a new score of 7, when you have a new score of 8, when you have a new score of 3, one parameter, what do you do? And tailor these answers based on your specialty or what you are doing. What do you do? So, prioritization. So now, for example, you have so many patients, those working in the adult medical environment or those in AMU, right? The AMU person. AMU is an environment whereby you're just getting the patient from emergency department straight in there. And you probably have one patient on glucose infusion, you have another patient with a new score of 7, you have a patient with urinary retention, you have a patient with hypoglycemia. How will you prioritize? What will you do? Okay, and it's very important in terms of priority that you're looking at. Number one, you must mention how you will ensure safety of the patient. You're looking at how you will delegate. And delegation, after you delegate, how you will go back to make sure that what you have delegated, the person has actually done it. Okay, because it's not enough to just say, I will delegate to somebody. Has the person done it after delegation? It's very important that you look into this. Okay, now you've delegated, the person has done it, and you find out that something has happened or your patient. How do you then escalate? All right. Now, in terms of safeguarding, what is the NMC code? What is nursing and midwifery saying in terms of safeguarding? Who are the safeguarded? Who are the patients we safeguard? Can someone give me an example? Who are patients we safeguard? And say it based on your units that you're having interview. I'm sure you must have prepped. Who do you safeguard? How do you recognize signs of safeguarding? Just shout one example.
Yeah, vulnerable adults and children, and the sign are maybe like neglect, physical, emotional, verbal abuse, exploitation, sexual abuse, and all.
All right, thank you so much. Can someone else shout from another unit? You community nurse now. How do you safeguard? Who are you safeguarding? We are our community people. Who are you safeguarding? You go to visit a patient. How do you recognize signs of safeguard? How do you safeguard? I know we have so many community. Where are you? If you don't talk, I will close community case today. Unless you are not here. Okay, research nurse. How do you recognize safeguarding and who do you safeguard while you are doing your research?
Okay, for the signs, maybe seeing injuries on the parts of the body that's not supposed to be injuries. Maybe you can also take maps or maybe pictures of it, injuries on the body parts where it's not supposed to be. And then for maybe vulnerable adults and also children. So
Okay.
I
And
have to
also
say.
when you are doing your research, so no, in research, it's not just only you're not just doing paperwork. There are patients that are volunteered to take this research. Maybe there's a medicine they're trying to research on. So patients have agreed to take it, okay? And then you're coming to administer that. The patients come on the day of you guys medicine clinics, right? It's different from the way the world operates. So, and then you are having a chat with the patient, or you are watching the signs, how the patient reacts to the partner or something. You'll be able to detect that something is wrong. You know how to raise up safeguarding. So wherever you are safeguarding. Okay, the person that's having a phone call assessment nurse interview. How do you safeguard? I can't remember the name of the role. That's why I'm using the phone call assessment. How do you safeguard? Where are you? Oh, I know you are here. Where are you? How do you safeguard? Let me look for that room. Maybe I'm not calling the name of the room well. Let me look down. Sorry, I've gone off. It's a band 6 row. Band 6. It should be a band 6 row. If you are here, you'll be able to answer me now. Unless you are not here. I'm not going to go back and start looking for it. Let me go back to what I'm doing. If you are not here, that's fine. But anyways, important that you know who you are safeguarding. What's the NMC code in regards to safeguarding? After safeguarding, the documents, right? It's very important that you document and escalate. Who are you escalating to? From who to who do this safeguarding message go to? So it's important that you do all of that. Next is infection and control. Yeah. So how do you manage infection and control issues where you are? How do you use the PPEs, the isolation techniques, the hand hygienes, and all of that? Another thing also that everybody will most likely get is trust values. The trust values. Okay. So the role that you are applying for, that hospital you're applying for, that trust you're applying for, most NHS will want to ask you, why are you applying to them? Why them? Most people will get this question, why them? Why are you applying to us? Why not London? Why not Liverpool? Why not Lincolnshire? Why not York? Why not Gainsbury? Why them? They also want to know, okay, so if you want to come and work with us, how have you implemented our values in your current practice? For example, now, the trust you are applying for, their value is patient safety, care, and innovation. How have you implemented these three values in your current care of practice? This one now is one of the questions they asked me in one of my interview questions. I'm telling you. How have you implemented this in your practice? And then they also want to know, why do you think they should hire you for that role? What makes you special? Why not Mr. B? Why not Mr. C? And how your vision aligns with theirs as a trust and a hospital. So these are questions that they ask. Okay. Now, this that's enough for, let's go a little bit specialty. So, but before I talk about your specialty, I have to be sure that you are here, so that I will not be talking in the air. Okay. So for, if you are having interview in regards to pediatrics, say yes. If you're having any interview concerning pediatrics, say yes. Sorry, I think I can hear someone talk back. I'm not sure. Okay. Maybe your network is not so good. So if you're having interview in regards to pediatrics, there's some things you need to look out for. Number one is, how do you safeguard children? Okay, you said yes, all right, so that's much. How do you safeguard children? All right. How do you recognize signs of a deteriorating child? How do you communicate with the patients or with the parents? Because some parents can be very pushy. How do you communicate with a parent that is not happy with your care or the care of the hospital? How do you communicate with a pushy parent? You have to recognize the fact that they are probably the way they are because of their child. Because imagine if it's a child that is sick, how will you feel? And you also have to know where to draw the line. How will you recognize sepsis in a child? Okay. How will you be able to use the new score to recognize early pediatric sign warning? How will you use the pediatrics early warning score? And what will you do when such thing happen? How will you manage sepsis in a child? Now, for those that are in cardiology, how will you recognize signs of chest pain? And what will you do? How will you be able to know, okay, patient that is on anticoagulation drugs, how do you do this anticoagulation therapy? ECG monitoring. You must not necessarily know how to interpret ECG, but you should be able to recognize when somebody needs ECG. You should be able to know, okay, how will you recognize? At least have a little bit background of ECGs, right? The VF, the VF, the AFs, and the rest of them. Have a little bit knowledge. Have a little bit knowledge of procedures that are being done around cardiology areas. How do you recognize signs of heart failure? How do you recognize signs of someone that is overloaded? Okay. What sort of medications do you have to ensure that they don't get all of that? Sort of medications. I will put them in worse issues. All right. Another thing that we need to look out for as well too, those that taking care of adults or those in the medicine area. This also covers those in AMU, even those that are in the community. Like I said, all of these are intertwined. It's for you to have a brief idea of these topics, right? So those that are in community, those that are in the wards, AMU, all of that. How do you handle a dementia patient? How do you care for one? Have to do with reorientation, right? Using the environment science, putting times and all of that things in place to make sure that they are being reorientated, handling them with care, compassion, communication, right? How do you recognize signs of delirium? You go to meet a patient, right? And then maybe you took care of the patient yesterday, and then today now you notice that the patient is saying something different from what they used to say. You understand? And then you notice that you can smell something very stinky from their catheter. Let's say you, especially those that are in community, they see this a lot. You go and visit an elderly patient in the community, and then suddenly you look at their catheter or their wound, you can just have a very pungent smell. And then the person is talking somehow like something different, saying things that are not correlating. How do you recognize and what do you do at that point? You understand? So also in terms of all this, how do you ensure falls and prevention of falls techniques and measures are put in place? How do you prevent falls? And if a patient falls down on the floor, what do you do? Okay. Also, if you enter a room and you see a patient on the floor, what do you do? And how do you prevent future occurrences? A patient that's always been falling on the floor all the time, all the time, all the time, all the time, what will you do? Put in place to ensure that such thing does not happen again. It has to do with things like false alarm, wearing them the correct, appropriate socks, making sure they've got the good lighting in the rooms, right? If they are necessary to have a bed, we're fine. If not, put them on a low bed. If possible, escalate to the nurse in charge or the matron to ask for a special one-to-one for those patients. How do you recognize signs of frailty in adults? Because if you are going to be taking care of a patient in the community, in AMU, in this, we've got a very aging population in the UK. So how do you recognize signs of frailty? How do you care for the older patients that are always within the frailty group? Now let's go to what are the assessment tools that you also use to assess for delirium as well too. Now let's go to community. Okay. Now, those within the community nursing is all about independent decision making. Why? If you are working in the hospital, right, I have my fellow nurse with me, right? I can know if I don't understand something or if something happened to I can always like ask for help. I will have to, or at times I have to go and get the doctors to come and assess the patient and all of that. So it's a shared responsibility. It's not independent. It's not only me. In as much as a nurse, you still have some independent making, obviously, in the hospital, but it's not as much as a community nurse. Because the community nurse, you are going to a patient home, right? to go and see them. You are caring for them in the home. You are bridging that gap. So when you get there and you see a patient has fallen from the stairs down to the floor, what do you do? How do you make an independent decision making? Who do you refer to? Do you call the ambulance? Do you send a message to a GP? You understand? How do you escalate the process? How do you document as well too? And how do you follow up to make sure that things are done? Also, how will you what do you call it, note a patient that has deteriorated? I've talked about that a lot. Now, for those that are having ambulance one-to-one, the band 6 person, how do you triage? Triage is almost the same thing as knowing priority. So you've got um um 3 patients that you need to call in terms of ambulance one-to-one phone assessment. How do you triage? Which one is priority? And how will you follow up? How do you send them to the GP or to the hospital? How do you do all of that? My recommendation to you is to go and watch lots of one-to-ones or ambulance what are they calling it, ambulance videos, and watch how they act. That will really help you a lot and give you an insight in case you don't have any insight. But good news is that they usually offer training for that position. Another thing you need to know, how will you risk assess a patient? Now, this is basically for the person, it's for everybody anyway, but I'm speaking to the person that has ambulance interview. How do you do risk assessments? The role that you are taking is a band 6 role. It's different from a band 5 role. So you need to know about leadership. How will you lead a team? How will you coach the junior team, the band 5s? How do you interact and make a decision known to other healthcare personnel that are being made? How do you handle conflicts as a leader? Also, how will you assess a patient over the phone? Now, one thing that you got, I know this one now is to that person that is having sexual health interviews, right? Now, one thing about sexual health is that it's a very, very sensitive topic. So how do you handle confidentiality? How do you ensure the patient's confidentiality is kept in place? When you want to talk about something sensitive, because sexual health is a very sensitive topic, how do you handle sensitive topics? Also, how will you educate the young ones on sexual transmittable infections? So you need to have an idea on how to educate patients. So now those that are in gynae, you need to know about women's health, how you will assess early signs. You understand? Safeguarding and also sensitive communication. Now, someone will ask me, all these things I'm saying, this is too much, yo. How do I do all of this? It's very simple. If they ask you question, how have you handled something? How will you do it? There's something that is called the STAR technique. You can use the situation, right? Who knows the meaning of STAR? Let's just start from there because anybody that is having an interview soon, you must know the meaning of STAR. What's the meaning of STAR? The STAR technique is a very popular technique.
Okay,
A
start
situation.
S is for situation,
Okay.
T is for task, A is for action, then R is for result.
All right, thank you so much. Now, the other person that is talking, when do you use the STAR technique? And when do you not use the STAR technique?
You use
The
the
question
STAR
again.
technique. Oh,
When do you use the STAR technique and when do you not use the STAR technique?
Okay,
Okay, me, I think. Okay, finish yours first.
I think when you use that technique is when you are asked a question to maybe you are asked a question like this. Tell me a time when you did something. I don't know what to use as an example. So using that STAR technique will help you to give give the illustration in like, so that you'll not just be beating around the bush and be telling the person stories. That using that star technique will help you to arrange your word or whatever example you are going to give. So I think that when you use that technique, when you are asked a question that you need to cite an example.
Right. Thank you very much for that. Any other person wants to give another answer?
Yeah, I believe it's the
Yeah.
same. When you're being asked a practical question and you want to answer in a scenario form, I think that's when you have to use the STAR techniques so that you won't beat about the bush. You'll be on track. Yeah.
So star means situation. What was the situation? C, what is the tax? A, what was the action you did? And R, what was the result? Now, when do you not use the star technique? Who knows the answer? When do you not need to use that star technique?
I think
Maybe
it's
when you
when
ask a
you're
direct
asked a
question.
theory or direct question. For example, tell me about yourself. You don't need to
Exactly.
start asking them, telling them any story. Just describe yourself and all of that.
Exactly. You do not need to use your star technique at that point. Because once you start using that, you've missed everything. Like you just start beating around, talk, and the other important information that you would have used to highlight some skills in tell me about yourself, you probably will not have time to do that. So you do not use the star technique in regards to that. Now, that person that just spoke, right? Can you tell me about yourself? We have started the mock proper.
Okay. Hello, good afternoon. My
Good
name is
afternoon.
Aja Mary Jane Ifechuku. I am
Okay.
a registered nurse with over 3 years of clinical experience across diverse healthcare settings. And I have strong experience in patient care. I also possess strong clinical skills in assessing patients' conditions, monitoring patients' vital signs, and also working collaboratively with the multidisciplinary team. Additionally, I am passionate about providing compassionate care, and I am I am passionate about providing compassionate care, safe care, and also patient-centered care. Through my nursing practice, I've developed good communication skills, um, good clinical assessment skill, and I am also able to manage patients with complex needs. However, I am particularly interested in this role in the in the general medicine department because it will allow me to manage patients with diverse medical conditions and also contribute to improving their recovery and well-being. All right, so I am eager to continue developing my skills um, while contributing positively to patient care within this NHS Lanarkshire. Thank you.
All right. Thank you so much for that. Now, can Miss, sorry, is that a Miss? Mr. I'll just call one of your names so that I don't need to call the full name. Is that a Mr. or a Miss Adeleke? Can you call Miss Mary Jane? So I just call your name. You just find a way. Wahala. Okay, yeah, you okay. Is that I don't know if that's a Miss or Mr. But can you call Miss Mary Jane on that? Tell me about yourself. Unmute your mic and speak now. I don't want us to take time seriously. So that at least we can cover like 5 people or 6 or even all of you if you speak up quickly. Okay. Can somebody else call Miss Mary Jane and what have she done well? And if there's any other thing she should have done to make it better?
Good evening.
Good
Thank you very
evening.
much for your time. I just want to add a little addition to what she said. She has done so well. but she didn't mention her qualification when she started. So she said she's a registered nurse, but she didn't tell us the qualification. Then she didn't tell us about her role, her responsibility within the unit, whether she currently work in that general surgical, I think it's general surgery units, her roles and responsibility. Then I didn't hear saying anything about the trust value as part of the reason why she applied for the role.
No, I think she went another way, which is actually okay with the way she went. But yeah, if she could also add like what she's working in a surgical unit. I'm currently working in a surgical unit and I manage maybe one or two patients, so that they will know that maybe if it's still within what she's applying for, or if it's a transferable skill, they can actually know that, oh, she already have a little bit of experience within this field.
The
That will
unit.
also make sense. So, Miss Mary Jane, what role are you applying for? Is she here? Seems her network has taken out. Anyway, since she's not here, let's have the person that just spoke now, that is Miss Afolayan. Afolayan. Sorry if I spoke spoil Afolayan. I believe I'm correct with that. Could you tell me about yourself?
Okay.
If I
You
not
tried.
pronounce it well, correct me.
It's
Oh.
okay. It's Afolanya, and you tried. You got it right.
Okay, all right. So can you tell me about yourself?
Okay, thank you very much. My name is Tawakalt Afolanya. I'm a registered mental health nurse in the UK with an active NMCP. I have a Bachelor of Nursing degree. Then I have a diploma in nursing and a diploma in nursing education with over 8 years of clinical practice. I've worked across various mental health units like the inpatient unit, the dementia unit, adult mental health services, child and adolescent mental health services in the other units. I currently work in an inpatient mental health unit where my roles and responsibility include conducting a comprehensive mental health assessment, using the nursing process as a guide, which is an evidence-based tools to assess patients, to do an evidence-based planning, as well as implement the plan, carrying along with the patient and the MDT, evaluate the plan to see the progress of the care, then make necessary adjustments in the care plan when necessary. I'm also responsible for carrying out a risk assessment of this patient in the unit using various risk assessment tools like the PHQ-9, the malnutrition universal screening tools, and so on. I'm also responsible for administration of psychotropic drugs, watching out for the side effects of these drugs and the positive effects. I'm responsible for raising concern as regards to safeguarding. If I see any safeguarding, I'm responsible for escalating. I'm also responsible for accurate documentation, working collaboratively within the multidisciplinary team. Aside from this responsibility, with my years of practice, I've got some experience, skills, and attributes which I believe is going to make a positive impact into the role if I'm given the job. Firstly, I have knowledge of the Mental Health Act and Mental Capacity Act, which are the legal legislation that back the assessment, treatment, and care of people with mental health disorder. For instance, I've been able to manage patients under the Section 2 of the Mental Health Act, which is detention for assessment. In addition to this, I have knowledge of the safeguarding procedures and the principles when it comes to any safeguarding concern that has to do with my patient. I have knowledge of the medication that is being used in mental health, the antidepressants and the psychotropic drugs. I have knowledge of de-escalation techniques and the procedure to follow when I come in contact with aggressive patients. My skills include, I have good communication skills, which has enabled me to function well within the multidisciplinary team, to relate well with my patients and other agencies that have to do with my patients. I have good interpersonal skills. I'm very approachable, I'm open, which has enabled me to build a therapeutic rapport with my patient and the MDT at large and the patient relative. I have good clinical judgment skills, which has enabled me to identify risks for my patients and to make a quick decision and escalate when necessary. I have good information technology skills, which has enabled me to timely document my patient details and information as regards to patient care accurately. My attributes are in line with the NMC C6, which is I'm a good communicator, I'm very competent, I stay in line with the trainings and ongoing courses for CPD. I'm a very courageous nurse. I advocate for my patient when need be, especially when it has to do with my patient safety. I always prioritize my patient at all time. I'm also a courageous nurse. I'm very punctual when it comes to work. I ensure that I speak for my patient, I advocate for them when necessary. Then overall, I apply for this role because I believe I have the skills, the experience, and the attribute that will enable me to contribute positively to give high quality evidence-based care to my patient. I also apply for this role because of the passion I have for people with mental health problem. I think people who are their most vulnerable moments in life is something that gives me joy as a person. And lastly, I apply for this role because my personal value of working as a team, being compassionate, uh, being excellent at what I do, and being open and honest are there or are in line with the your trust value, which I've demonstrated throughout my career to give high quality care to my patient. Thank you.
Okay, thank you very much. Thank you so much for that. So can someone else score her on her um response? Can someone score her on her response now? Let's make this interactive. It can't be me doing it all. Let's hear
All right.
from you.
Okay. All right. Well, I think she did well. Just that what she said were too much because I believe tell me by yourself should be within 2 minutes. So I think she has to trim her answers because it's as if she has answered all questions the interviewers want to ask throughout the interview in one question. So I think she needs to trim her answer because she talks too much like what she said were too much. So I think she should trim her answer so that she can give her answer within 2 minutes. That's what I think.
Okay, thank you so much for that. And I'm in support as well. So I agree that you did so well, right? But I also have to say that you need to trim your answers so that they can have time. Because tell me about yourself is between 2 to 3 minutes. You spent up to 5 minutes speaking. But I did have to give you that time to speak. I also felt like I don't know if you had cramp, because I could see you pausing, trying to remember. It wasn't flowing as a free conversation, or probably because you are still practicing and you've not probably like maybe you're still practicing, right? When is your interview?
I have one on 12, then the other one on 20th.
Okay, so just keep, but it's actually a good thing for someone that has interview on 12th. You've done very well, okay, because you have a baseline. You understand, which is so good, right? You have a baseline. You're speaking well. You confident when you are speaking. I could detect confidence. I could detect that you knew what you're saying. I could detect that you knew what you're doing, and like yes, you've done it. And even if you've not done some things, but you have knowledge base of some things. I could detect that as well too. But the thing is that when you're talking about tell me about yourself, when you want to talk about some qualities or what you do, some of them can be summarized. So rather than saying I have knowledge of medication administration and the drugs, and I have knowledge of this, you can just say I have knowledge of medication administration, and you could combine them together rather than like saying like one paragraph. I have knowledge of medication administration. I have knowledge of this one, that one. You could say I have knowledge of medication administration, and like it could be put some of them together. And then some
Okay.
examples which we are giving, right? you could, especially, I believe you went through the like the IT stuffs, right? And then you went through the essential your personal specific person specifications, right? So under the, for example, now they say qualities that they are looking for, and they say essential qualities. You can pick two, right? Or three, just two, and talk about those two and move to the next one. You understand? That's because they are still going to ask you questions, right? In regards to some of them. So those two that you are picking, let it be the two that you know you can, it's a very standout one for you, right? So you can pick two or three and move to the next. So rather than having to talk about everything, because everything is going to make you like, once they've heard the first 1 to 1.5 minutes, some of them will just lose interest and be looking at you. Okay, okay. I don't know if you get. So and imagine you still have something important to stay at the end. They would have probably forgotten that bit or didn't catch that bit. And also, when you're talking about your roles and responsibility, that part, so you could trim it a bit, right? And maybe like give two or give three, or just if you can come, just some words you say, and rather than saying she is a fine girl, she is a beautiful girl, she is a decent girl. You can just say she's a fine and beautiful girl, right? It's
Okay.
combined that you get, it's already combined. So they've already made
Okay.
that point. So the time spent to say she is a has been removed. I don't know if you get.
Yes, I
Do you understand?
understand.
Exactly. So it's a very structured and well detailed tell me yourself. And if I'm going to score you, I'll score you 8/10, right? But to make it better is to trim it down and use maybe two or three examples rather than having to talk about every single stuff you get ahead.
Okay.
You have to give them space to ask you some other questions as well. So, but well done.
Thank you.
Um, you're
I
welcome.
appreciate
You're welcome. Now, the person that did that, that's reviewed her, could you tell me about yourself?
All right, thank you for the opportunity. I'm a registered adult nurse with over 2 years of strong clinical experience providing safe, evidence-based, and compassionate care to patients. I have mostly worked in theaters in my career, and I also have some experience in acute medical work. I have worked as a scrub nurse, circulation nurse, anesthetic support recovery nurse many times during my career, and I have also looked over patients with acute we, um, patients with various medical conditions such as heart failure and heart blocks requiring pacemaker insertion. I have taken responsibility of my professional development by maintaining my portfolio, completing relevant training courses, participating in audits and policy improvements, reflecting on my experience to continuously improve my clinical practice, and in my current job I have received positive feedback from senior staff for my professionalism, teamwork, and leadership skills. I have been described by my colleagues as a good communicator and an excellent team player. I have been trusted by senior staff to help train new staffs. I am very flexible, very teachable, and I am always eager to learn. And finally, I adapt easily to new workplace. Thank you.
Okay. So why did you apply for the role?
Okay, I applied for this role because having studied the job description, I believe my skills and experience are a perfect fit for this role. Since I have over 2 years of experience in theaters, look and also looking after acutely ill patients, such as patients with cardiac conditions such as heart failure and heart blocks requiring pacemaker insertion. And I am also Resource Council ILS certified, a training that would help me to thrive in this role. And I'm dedicated to patient safety, and I enjoy working with the wider multidisciplinary team. All these skills put together would ensure that if I am fortunate to get this job, I'll be able to continue the usual tradition of this trust in delivering high quality care to patients. Thank you.
All right. Thank you very much. Can somebody review him? Can somebody open the mic and speak? It could, even if you have spoken before, you can, or even if you have done, it does not mean that because, oh, um, I've done my own, I cannot speak. No. Can somebody review him?
Okay, I think he did very well. He went straight to the point, especially in tell me about yourself. I think he did very well. He just went straight to the point. It was very clear and concise. So I think he did well. I give him 9.5 over 10.
Okay, all right, thank you. So you did well, but you didn't add. That's why I pulled you back and say, can you tell me so why you applying for my role? Because I didn't get that bit right. And I think you were very conscious of time. You're like, okay, I want to talk within 1 minute and just all of that. But I think you should calm down, drink water. Okay, I've been drinking water since, right? So you need to calm down. I do understand. Some of us speak fast. Like I do speak very, very fast as well too, right? But just as you're speaking fast, make sure you are hitting some points, which you did, though you did tell us, and I'm sure you're applying for a cardiac role from what you are saying. Is it a cardiac role you're applying for?
Yeah, it's a cardiac role.
Yeah, I could see that. So that's very good. And that's one thing I want to tell everybody. If you are a mental health nurse or you're an adult nurse, right? And you're applying for a cardiac role, you understand? While you are talking about the people you are caring for, make sure that it's in line with that role. You've not been working, but just line it because obviously if you're applying for you've definitely taken care of people that are having heart hypertension, heart disease, right? So just talk about like, oh, I've cared for patients with such conditions. You mention one or two, so that they know that even if you are what are they calling it, a medical nurse, you've taken care of patients in regards to the others, right? It will make them know that you are closely aligned, right? So it's very important you do that. But don't forget to add why you apply for the role, okay? Or what else you can add to their team if they take you. And imagine you were talking at the end when I asked you, so why do you apply? And then you put in your ILS. That's a beautiful one. Because I was going to ask you your next question. The next question I would have asked you was, what professional development have you done while you've been working? You understand? Like, have you done ILS? Have you been undergoing CPD training? You know, when you are working as a nurse, you need to be doing some professional training. So you can add, oh, I'm someone that loves learning. I'm someone that loves developing myself. I'm someone that loves to keep up to date with practice. And so I make sure that I'm up to date with my ILS training. I'm up to date with recent development with my practice. Or if you've done any course, or I've done a PG course in this, or I've done a diploma course in this, or I've done a self-learning course in this, whatever, even if it's one or two, you can mention to them that you are really interested in research. Because every company now are looking for people that are innovative and research based. So thank you very much for that. You have done that. So Nas,
Right.
tell me about yourself.
Okay, thank you very much for the opportunity to be interviewed for this research nurse role. About myself, my name is Ariel Augusta Norma. I'm a graduate registered nurse holding a bachelor's degree from Imo State University, Owerri. Following my graduation, I embarked on a 1 year internship program at University of Teaching Hospital, where I was opportune to work in different wards and units. After the completion of my internship program, I was awarded as the best intern of the year by my senior manager due to my dedication to work. I'm currently a registered adult nurse with the NMC UK with an active and valid PIN, which enables me to practice effectively and safely within the UK system. I have over 4 years of experience working in an acute and general hospital setting at Imo State Specialist Hospital. I've worked in clinical wards and units, community setting, and I currently work at the research department where I provide holistic and patient-centered care to patients to ensure patient safety. I also assess, plan, implement, and evaluate patient care. And also, I'm able to work collaboratively with the multidisciplinary team to ensure that patient safety is maintained at all times, which is my utmost priority. I've also developed some clinical skills which are relevant to this research role, such as interpersonal skills and communication skills. I'm a confident and compassionate nurse and respectful. I treat my patients with dignity and I maintain their privacy at all times. I have a good interpersonal skills and communication skills, which enables me to interact with my patients daily my colleagues, and also my patient relatives. And then I'm also proficient in the use of computer system. I'm able to record patients' electronic data and also research databases. And then also I'm approachable, I'm respectful, and I'm also I'm compassionate, I'm respectful, I'm also a caring nurse. My goal is to combine my clinical experience together with my research experience to ensure patient safety during research protocol. So this is what I can say about myself. Thank you.
All right. Thank you so much for that. So can somebody score and evaluate her?
Yeah, well done, Nurse Neoma. I think she didn't have why she applied for the role. I think you corrected the last person about that. She didn't have that.
So, Norma, why did you apply for the role?
Yeah, I applied for this role because I'm motivated to contribute to the delivery of safe, ethical, and highly quality clinical research that positively impacts patient care. And I also want to contribute my clinical skills and research experience to contribute to studies that directly improve patients' outcome. Thank you.
Okay. All right then. Thank you very much for that. So, who is the person that evaluated Nurse Norma now? I believe you've spoken already.
Yes, I have.
Haven't you?
I have.
Yes, I felt like you have. So let me just score Nurse Norma. So yes, you did well in terms of tell me about yourself, right? I was listening to you because I'm aware that you're applying for a research role. But to some extent, I felt it was too generic. I don't know why. It was good, but it was really generic in the sense that um I was expecting one word that will kind of pull it home to research. I don't know how to put it, but I was expecting something to pull it home to research. I like the way you went. I like the way you went, how you started from where you are, where you've worked before, where you are working currently. So probably I was expecting you to say I currently work as a research nurse where we look after and where we engage in day-to-day research or do medicine research or do test of drugs research with patient and ensure patient safety while carrying out medicine innovation. Then you move to the next one. I don't know if you understand. I don't know if anybody is trying to understand what I'm trying to say. Did anybody understand where I'm coming from?
Yes.
Yeah, because it's generic, and if somebody that has lots of experience as a research person, they'll kick you off the end goal. You understand? So it's very generic. It's good, but it's not best, right? So while you're talking about who you are, where you work, where you're working, right? In the part of where you've working, like you could listen to someone that was talking about cardiac. He mentioned one or two cardiac stuff. You could play back this record to listen to him. Then the other person that talked about mental health, you could hear something when she's talking about some mental stuff. You could get, oh yeah, this person is looking like she'd not just say mental health. She'd not say I'm a someone that's a mental health. Then she moved. No, he talked about where we've used some assessment tools to do some risk assessment and give some medical some mental health drugs. I know about the section 1 and 2. Full stop. You don't need to go too far. Section, you don't need to be explaining what it is. That's what I was trying to tell the other nurse. She was explaining what some of them are. You just need to go straight. But let them know that you don't just say mental health. You have used a mental health assessment tool. You know about the section 1 and the section 2 full stop. Then you can move to the next one. Same as research. You could talk about okay, where we carry out day-to-day research activities, or where we carry out day-to-day or we carry out introduction of what are they calling it, new medicines to the hospital, and then we also ensure patient safety when carrying out this research, or we also hold regular research meetings to make sure that I don't know, like just add one or two statements to bring it home before, so it will not be too generic. You understand? You get, and qualities, right? I love the fact that you use communication, but don't just say. But I do like the fact that you said that you've been um regarded as one of the best intern, right? But one thing I could pick from the previous person that spoke, the love star also, was when he did not just say I have communication skills. He said my colleague has praised me on how good my communication has been with patients, and then he mentioned something else. So he just makes, he does not need to tell them I've got, they can hear that, they can hear that. You understand? What I used to use there, I say my patients have communicated, have commented on how good I communicate well with them. You understand? And then there's a way he went about his interpersonal. He did not just say I'm going, that he kind of brought it home, but he was not explaining and using the star technique. You understand? So communication is a very key part in terms of research, right? That's one thing. Patient safety is another key part in terms of research notes as well. So if you can use those two as your key examples, it will make sense. So it's a good one, right? But it's not 100% or 90% or 80%, because if someone else has a strong research experience, they will kick you off. Do you understand us, Norma?
Yes,
All right, that's fine. So when is your interview?
11th.
Okay, so you've got time to do that prep. Okay.
Okay.
So just work on that bit and you'll be fine. I like the fact that you are confident. Don't forget to tell them why. Another place you can also chip in why you want to work for them. But if you look at the rest of the other team where they are ending, you could see them talking with confidence. I'm applying for this because what I'm done, what I've been doing is what I'm going to come and bring it in and make it better with your help. You understand? There's a way they put the words. I don't want to go back to that bit now, but you could feel the confidence as well. So uh, why you apply for this role could also chip in one or two research words. You must not just say research. Look for interrelated stuff that could really show that you know what you are saying and you know what you are doing, talking about. That will really help you in regards to that. Okay. So let's end that for tell me about yourself, because
Sorry, please, I have a contribution. Is it possible
okay,
she
go
make
on.
a reference to, okay, is it possible that she makes reference to the research work she did while in school? Without one
Well,
also be
she
a
can, yes,
plus?
she can chip it in. Yes, I've got a very strong interest in research. And so when I was in school, I did a research and it was very, very successful and people talked about it. Full stop. Don't go too deep. Do you understand? You don't need to go too deep. So you can go whereby I've got strong keen interest in research. Even when I was in school, I did a research and it's made a remarkable improvement in our organization or in our school. You understand? Maybe you did a research in how students did something with the page with these teachers, or how to improve teacher and student relationship. You understand? And it's made a tremendous improvement in our page in our in our university. Full stop. You don't need to tell them how you went about it. All those ones are start technique. What happened? That one is start technique. In tell me about yourself, you just say, you generalize that word like, oh, I did I have a strong interest in research. Even when I was in school, I did a project, or I did a program or a research program or relationship between students and how to improve it. And it's made a tremendous effect in that. Move to the next one. Full stop. Don't go too deep so that you won't take time. All right. So yeah. Um, all right. Since the people that are talking are the people that answered and nobody picked up, so correct no so normal. That will
Can
be
I
the end of
can
them.
I talk?
So,
Can I
that will be
can
the
I
end of
talk?
telling me about
Can I
yourself
talk,
question.
please?
You refuse to talk now. I'm saying I want to go
Oh,
through now. Then I can ask some few generic questions so that we can come to an end, because we spend like almost an hour or so in here. And if you can hear the background, my baby is crying and I've given her to her dad. So Yeah, but let's go to the next one. Let's have Nurse Esther speak. Tell me about yourself. You said,
Okay.
can you talk now?
Thank-
And then
Yeah.
I think is it Miss A, the second person that was saying, can I talk? You assess her, and then so let's hear you speak. So carry on then.
Okay. Thank you for the opportunity. My name is Esther Kunedi Danso. I'm overseas nurse currently registered with the UKNMC with a valid PIN. I have experience in providing person-centered care in patients with acute clinical settings, including cardiology units. During my nursing career, I've developed strong skills in patient assessment, planning, implementation and evaluation, and multidisciplinary teamwork. I have a particular interest in the cardiac nursing and caring for patients with cardiovascular conditions such as heart failure, myocardial infections, and arrhythmias. I enjoy working in a fast-paced environment where monitoring patients closely and responding quickly can make a real difference in outcomes. I consider myself a compassionate and organized nurse who prioritizes patient safety, effective communication, and evidence-based practice. I also value teamwork and supporting colleagues to provide high-quality care. I am very interested in joining the cardiology team at Bath Health NHS because of its reputation for excellence in cardiac service and its commitment to professional development and high standards of patient care. I am eager to contribute my skills while continuing to develop as a cardiac nurse. Thank you.
Okay, thank you so much for that. Can you assess her now? The second person, how did she do?
She did excellently well. So I can give her 8/10. She did well.
Okay. Did you tell us why you applied? Did she tell us why she applied?
Yes, yeah. She said
I
the
did
reason
it.
why, yeah, because of their excellence, outstanding
Yes.
stuff. Yeah, she
In
said that.
cardiac service and its
Yeah, in
commitment to
cardiac,
professional
yeah.
development.
She
Yeah.
said it.
Is someone else speaking? Okay, all right, that's fine. So, not Esther, you did well, and I can sense that you're applying for a cardiac, a cardiac
Yeah.
role,
Cardiac
right? Because I
role,
could
yeah.
hear you trying to. And are you working in a cardiac unit now, or you're trying to relate your experience?
I'm trying to relate my experience.
I could sense that as well too. See, all these things, we sense all this stuff, right? So yeah, I could sense that as well too. So did you talk about any maybe you've done any trainings or anything? Have you done any ECG training, ILS training, anything in terms of any
Yeah.
training, professional development?
I've
Did
done
you add that as well to the conversation?
no, I didn't. I didn't.
So but have you done any?
Yeah. ILS, I've done it.
Yeah, so
But
if
I
you've
haven't
done
done easy.
ILS, if you have knowledge about ECG monitoring, you don't need to say you've done the
Mhm.
training. You just say, I also have knowledge about ECG monitoring. You understand? Um,
Okay.
or let's say you know about recognizing signs of deteriorating cardiac issues, or you've had trainings, yes, on
Mhm.
deteriorating patients with cardiac related issues, like that's you say
Okay.
in terms of professional development, I do like people to talk about some professional development, right? Makes them know that, okay, yes, apart from the fact that I've worked in relation to that, I've got some trainings that also solidifies me. You understand? So I'm not just working based on my head, but I've got trainings that are base knowledge, good solid knowledge basis, right? That supports and also the reason you're applying and your qualities and all of that. So that's fine. So the person that so well done, thank you for that. The person that so just add that to make your stuff better because if I'm going to take you, if I'm having an interview, I will take Love Star over you because you did not talk about what to do. But if you add that a little bit of what are they calling it? If you add that a little bit of what are they calling it? A little bit of that training, it helps to bring it home. But also you did very well. Now another thing that will help people that are doing relatable experience, one thing that will help them is when you talk about yourself. right? And make sure you relate just like you have done now, Miss Assistant, just as you have done. Make sure you relate. Then, in other questions that they are going to ask you, follow up question, because they will not be very interested in your follow up question, and that is where you will score very high. You understand? So when you know you've not worked in that field, but you have relatable experience, and you tell me about yourself, you've done relatable experience, then in the follow-up question, like, why did you apply for this role? Can you tell me when you've taken care of a patient with cardiac chest pain, what did you do? You understand? How do you recognize signs of a deteriorating patient? Have you managed a patient with heart failure? How do you recognize signs of how do you escalate and all of that? And even when they say, can you give me an example when you notice a medication error, you could even say, oh, you can use something like IV furosemide. These are cardiac related drugs, but they don't necessarily have to do it in cardiac unit. Even in normal wards, they do it. So you notice
Yeah.
that there was a time one of your staff member was giving IV infusions, IV furosemide, and the prescription that was done, that is for a patient that is having heart failure. So, as you're giving that example, they'll say, wow, so she really, even if she's working in another ward, she's really handled some of these things that we do in our ward. I don't know if you are getting what I'm saying.
Yeah.
You understand? I don't know how to explain it. It's it's like strengthens. So while your tell me about yourself is good, is like 80%. Like I said, your tell me about yourself is good because it's relatable and it's nice, right? Just add those things I said. Then when you are now, but someone that has more cardiac experience, tell me about yourself, might not, maybe you get 80, the other person might get 82. You understand? Then when you're not talking about, can you tell me about situation whereby you've done this? While you're giving up using the STAR technique, if you can kind of use an example of a relatable patient and use the example in terms of cardiac related, maybe a patient you've handled that maybe has heart failure or MI, or use one of those examples as that. It will make them feel like, oh yes, this person is good. It brings it home. Do you
Mm.
understand?
Yeah.
I hope what I just said is helpful to you.
Yeah.
So,
Yeah. Thank you. Yeah.
okay. All right, so that's fine. But that doesn't mean that if you don't do it, you will not still get the, because you are being trained for the role at the end of the day. You understand? You are being trained for the, and if you know that if you say that example and you don't know how to say it well, and it will make you not get high, if you don't know how to arrange it very well, just go for the one that you feel like you can arrange very well. You understand? But if you know you can use it and make it very well, then you can use it. So the person that reviewed her, tell us about yourself, and you'll be the last person for telling me about yourself.
Okay, thank you for the opportunity. My name is Joy Elago. I'm a registered nurse with over 4 years of nursing experience. Right now, I am currently working with Signet Healthcare, where I provide high quality care for my patients, collaborate with other multidisciplinary teams to provide optimal care for my patients, assist them with their activities of daily living, and then work with the policy safeguarding and infection control policies. I have gained various experience. I've worked in various healthcare settings where I've gained my nursing skill experience, such as the orthopedics, the medical and surgical world, and emergency department, where I've gained my nursing transferable skills, such as IV therapy, IV therapy, um, canalization, wound care, tracheostomy care, and sorry. Sorry about that. So I am compassionate in delivering my care. I am patient centered. I have a strong communication and observation skills. Um, I have sorry, I'm quite distracted.
That's the thing. See, you see one of the rules of distractions, right? And another thing is, in as much as even when the distraction goes away, you you have to probably you stopped at saying something. You have to take like 1 or 2 seconds before you get yourself. So it actually affects you. It's not like you might not know what to say, because you started well, but obviously, I don't know, maybe you've got children there that's disturbing you and all of that. So that's fine. But I think I don't know when your interview is, but you need to practice more undistracted for that interview so that it will really help you do very, very well. Okay. But you started well, you were talking well, so that shows confidence. Okay. That shows confidence. So well done. Now, so let's have a little bit of let's go a little bit in depth. For
Sorry.
someone that is, go on.
Sorry, this is Mary Jane. I had a bit of network issue. The first person that spoke about yourself, so I didn't get like correction on what I said.
But I think we gave correction for Mary Jane, and don't worry, you go and watch the session. At least you're the first person. If you watch the because now I'm not going to remember because I've done like 7 or 8 persons on
Okay,
after you.
thank you.
So I probably will not remember the exact um what are they calling the exact stuffs I said about you. You understand? But you can just have a little brief, and it's going to be easy for you because yours is going to be the first person that spoke. All right. So the person that is having mental health nursing interview, could you tell us um how would you assess suicide risks and what will you do?
Thank you very much for the question. With my years of practice, I've come in contact with patients with suicidal ideation, and there are things I put into consideration. I take past risk history if the patient has had as maybe has had a thought for suicide or tried to harm him myself previously. I take past medical history, past mental health history, so that as to have a baseline data. So recently, I had a patient who opened up to me that she has been having the thought of killing herself, and she has had some plan. So my role is to prioritize this patient safety and use a collaborative approach, a trauma-informed approach in delivering care to the patient. So my actions were I build rapport with this patient. I use a calm, I use a calm and an active listening to explore why the patient wants to self-harm herself. I let her speak without interrupting her. I give her time to tell me about her plans, the plan she has in mind to harm herself. Then after doing this, I conducted the risk assessment to know the area of risk, the level of risk, and the triggers to know what the underlying cause of this thought of suicide, what they are. I used the risk assessment tools, which is the PHQ-9. Then I was able to deduce that she's depressed due to a recent loss of job. Then I relate back to the MDT about my findings, the assessment that I conducted, her plan to carry out the suicide plan, then the risk assessment that I conducted, the tools that was used, and what I was able to deduce from the risk assessment. Then I collaboratively with the MDT, the patient and the family, were able to come up with an individualized patient-centered care plan to address the thought of suicide. I ensured that during the MDT meeting, I advocated for the patient. I ensured that patient preferences are put into consideration. I ensured patient participation throughout the meeting. In addition to this, I work hand in hand with the patient to develop, to set some goals, smart goals, so that we can achieve the goal of the care plan. Then make I make necessary referral to the psychologist for talking therapies, for some section of talking therapy with the patient, and I followed up and I ensured that the patient had section of talking therapy and psychotherapy so that to come out of the depression that she was in. I didn't stop at that. I ensured that I liaised with the psychiatrist on her medication, antidepressants. I ensured that I administer this medication following the rights of drug administration. I also ensured that I did accurate documentation, fill an incident report as regards to what the patient told me. I ensured that I documented everything, the time, the date, the name of the patient, and the step that I've taken to address the issue. I also ensured that I make the report in line with my organization policy and procedure as regards to an incident of such. I didn't stop at that. I keep evaluating the care plan of this patient, doing some section of talking therapy with the patient, give some psycho education to the patient about the care plan, the medication regimen, and how she can improve her mood. Then at the end of the day, this patient was able to come out of the depression. The thought of suicide reduced drastically. She was more willing to involve herself in work activities, and she was more willing to have a section of talking therapies. This whole scenario taught me the importance of prioritizing patient safety, use of effective communication skills, and MDT approach when it comes to a patient that has a suicidal ideation. And this is also in line with the NHS value of being compassionate and being empathetic. Thank you.
Well done. Thank you so much for that. Now, one thing I want someone to pick is, and this thing I learned it from an interview. Okay. The question I asked her, right, was how do you assess how do you assess a suicide patient and what will you do? I did not ask her, can you tell me a situation whereby, but she went further to buttress it so that she did not just give a generalized answer. You understand? And that was a feedback I got from one interview I did years ago. And they were like, oh, you were very good, but there was just one certain question we asked you. And while you gave an answer, you did not give an example. So, but you did not ask me for an example. Yeah, but we're expecting you to at least bring it home. Do you get that? Do you clock that? Do you get? So it's
Yes.
exactly. So after the tell me about yourself question, any other question that they ask you, if you can give one don't give more than one. One is fine. Like this kind of question, can you tell me about a situation? Because this now you're trying to show yourself that yes, you've done such thing. So about you, how you not just say, okay, a suicide patient and this that she just said, oh, there was a patient and then she just explained. So they now with the explain of what she did, it enables she's already answered the whole questions, right? Using that approach. You get, and if you are someone that has not done such thing before, you could use something like, I will do this, and I will do that, and I will do this, and I will do that. That's another way of doing, like buttressing it. Like if I have a patient, this is the step I'm going to do. I will do this and I will do that, then I will go this way and I will go that way. And then after which I'm going to evaluate. And so it also helps them to bring it home. You understand? So that's if you've not done such a thing before. But if you know that you can think about something and just say you have done it, something or relating it, it also helps. So, or if you can relate it to any other situations, you can, and that will also help you fly. So thank you so much for that. That was a very good one. Now let me ask someone that did cardiac thing. This is to see love style, so that's what I saw. I don't want to ask you this one.
Please have a
Someone has a question.
yes.
Hello.
Yes, I have a question.
Okay, go on.
Say that after tell us about ourselves. Any other question that we are asked, we should give an example.
Yes, if you can give an example, it's like now. For example, they say what question did I ask her now? How will you identify a patient that is deteriorating? Or how will you recognize how will you assess a patient that's having that is having how will you assess for deteriorating signs when you're administering medication as a research nurse? You say, okay, so the first thing I'm going to do is I'm going to do this, I'm going to do that. Well, I've had a patient doing my care, and this is what I did. I went this, I do that, I do this, I do this, and then at the end of the day, this happens to the patient, full stop. You understand? So any question after telling me yourself, if you can, relate it to an example. It must not be a very lengthy example, but if you can relate it to an example using the STAR technique, please do. It helps to bring home, and it makes you unique and different from to others. You understand? It makes you unique. Do you get? Even if you can create an example, please do.
Yeah, thank you.
The only questions like, can you tell me why you apply for this role? Even can you tell me why you apply for this role, Seth? Let's say you apply for the role of a community nurse, and you say, okay, the reason I apply for you because I have keen interest in taking care of people in the community and all of that. I could recall a situation whereby I noticed, maybe if you've not had experience in the community before, you say, I've noticed a situation whereby when we were doing a voluntary, I joined a voluntary group, and then we went to the community to assess people and support them at home. I could feel the impact and the necessity of having to bridge that gap and taking care of people there. They don't need to be in the hospital. They can be cared for at home and given the utmost care. And ever since then, I've had key interest in supporting people. And that's why at times I join voluntary organization. At times I support my friends and their family while they're at home as best as I can. Right. So just buttress it. I don't know. Do you understand what I'm trying to say? If you can, just relate it so that they'll feel like this person is unique. Do you understand?
Yeah, thank you.
Yeah, so yeah, so if you can bring it specific because you are trying to sell yourself in an interview. So make sure you're selling yourself very well. Okay, so let's ask the cardiac team now. This question is to Love Star, right? So what signs should I use this one for you? Yes, should I use? Why is continuous cardiac monitoring important? Is it still here? So is the cardiac team. Oh. Is it still here?
Okay, I'm here.
Uh-huh. All right, shoot me.
Okay, sorry, could you repeat the question?
Why is continuous cardiac monitoring important?
Okay, thank you very much for that question. Continuous cardiac monitoring is very important because it helps to detect early any signs of deterioration so that it could be escalated early and the signs would be managed early before complications occurred. And furthermore, it also helps to support patient safety during treatment. um for example, um I while taking care of a patient with acute heart failure, although the patient seemed fine, but then when I checked the vital signs, I realized that the pulse was below the normal range. Therefore, I escalated immediately and I did full assessment on the patient. Why I escalated and the medical team and the nursing team came, I ensured that I provided emergency equipment necessary for proper management of the patient, and I also ensured proper documentation, and we were able to prevent complication, or we were able to prevent the patient's condition from becoming worse. So continuous monitoring of cardiac patient is very important to prevent complications of science. Thank you.
All right, thank you. You need to work on your answer. Oh, yeah, example. Very well, because it has to come home. Okay, it's good, but it seems like you're not confident when you were speaking. It was feeling like you've not done it and you're forging it. So if you want to say it well with confidence. You don't need to rush. Calm down and so that at least calming down to give some example make you like while your brain is working and talking, right, to help you. So your answers are good. There just some other points that you can add as well too, like detect any heart issues early, arrhythmias early or whatsoever. And it's also guide treatment decisions. For example, if you're able to detect a patient for let's say now cases of hypotensions, right? And you'll be able to it will help them guide treatment decisions. So if maybe they are trying to start a patient on ibuprofen, they are trying to start a patient on any medication that will help to bring down solve a cardiac particular issue. And then the patient is on continuous cardiac monitoring, because continuous cardiac monitoring at times might be that I don't know if any of you know about it. At times, if a patient is on continuous cardiac monitoring, it's different from just going to check blood pressures all the time. It's like it's a machine, right? That is being attached to the patient, like ECG machine. So the cardiac nurse is the one that is holding that machine all the time. Most of all in the cardiac ward, it's there. And so the patient's heart rate is monitored every time. So they can detect, they can do it for like 24 hours. It can be the 24 hours cardiac monitoring. It can be the 48 hours cardiac monitoring. You understand? And so they can detect any at the end of everything, they will print out the results. And so what they're trying to do is they want to detect throughout the whole day, have there been any issues in terms of the patient's heart? Is the P wave, is there a missing P wave? Is there an elevated T wave? Is there any signs of hyperkalemia? Is there any signs of heart block? You understand? So these are what they are trying to detect, right? And so if they're able to detect it, it will help them guide their treatment decision. It also ensures patient safety, like you have said, right? Like help them to be able to know how they'll care for the patient better, what treatment, and make all the team get action. Like in case there's like a ventricular fibrillation during that period, because this kind of treatment will not dictate that immediately, and all the team will quickly get involved to get the patient back. It also helps for early treatment and early recognition of complications and make the patient get treated faster, because when something gets late, it might be harder to treat as compared to when it's detected early, right? It also helps to monitor heart rate and heart rhythm and all of that. Do you understand? Are you
Yes,
there?
yes,
Do
yes.
you, do,
Thank you.
do, do you get? I don't know if you understood what the where the continuous cardiac monitoring from, but do you understand when the continuous cardiac monitoring I'm talking about now?
Yes, I understand. I understand.
There, have you seen it before?
No, not that.
Right. So it's like a box of what are they calling it? Um, it's just it monitors the reading. You know ECG, that ECG
Yes,
line, right? So
yes,
this one helps to also monitor. So they use it a lot, and it's usually used by the cardiac care team or the cardiac nurses, right? They attach it to a patient like ECG strip, and they can keep it with the patient for either 24 hours monitoring or either 70 hours. So you have to be trained to be able to use it anyway. Not anyhow person can use it. You understand? But the main aim, which you have mentioned, number one, to detect early any complication early. You understand? Detection early. To monitor the heart rate and notes for any complication, heart block, AF, VF, high T, missing P's, and rest of them. There is also guides treatment decision to make them know what treatment are they going to align with the patient. Also ensure patient safety, which you've also said. So, even if you don't know that part, but you say the others, all these other parts, it's also good. And you've given example from your own context, which also shows that you were thinking about in terms of blood pressures and all of that. And if you are going to checking all those ones 1 hourly or all of that, that's not continuous though. But at least you mentioned about going to check that one and then to detect. That's also good as an example. You understand? And they could also explain that for you in the interview in case they ask you that question. But yeah, it's still you. But they will be able to recognize the fact that you know the reason and the rationale behind why it's being done, and that's also a pass mark. You understand? So the second cardiac person, could you tell me a patient complains of chest pain, what will you do? Let's have a quick answer, please. What's her name? She sounded. Are you
Sorry, please,
here?
can I ask a question?
And before you ask, I just want to be sure if she's here. If she's not here, so I'll start getting the next question ready while you're asking yours. I don't think she's here. So why she's not here? So ask your question, please.
Thank you. For Lobster that just answered concerning cardiology, can he use, if he has an ILS certificate, can you use an ILS certificate example?
So how would he have put the example?
Okay, maybe okay for the fact that when it comes to cardiology, he is vast about it, or is keen into it, that because of that he underwent the ILS training. Is it like, does it go along with it?
Is it with the last question I asked?
Yes.
Not necessarily, because they're asking you how will you what's the extent of a cardiac continuous cardiac monitoring.
Okay.
So he answered the question. You understand? It's just the example. When he was giving his example, right? I've just added some things that he was supposed to add, which was fine. But I also needed him to understand the difference between continuous cardiac monitoring. Because just like the name continuous, it means no break.
Okay.
You understand? The name continuous means no break. So it means that the patient is monitored there continuously for a
Okay.
certain period of time. And obviously, using from our nursing knowledge, the aim of all of that is to why would they keep somebody on a continuous monitoring? Is it not to detect something?
Yeah, sure.
So that's the whole idea. So you could have used that. Just you could have even framed it that I've had a patient who was once on this continuous monitoring, and we're able to detect that the patient had maybe look for any condition, AS, or maybe does not want to say a condition, but we're able to detect deterioration, or we're able to detect that a patient had
Abnormality.
a heart complication. You understand? And we're able to resolve it. So you don't need to be so specific, right? If you can just use a generalized word like like a heart complication, and because of we're able to detect that, we're able to treat it quickly, and thankfully the patient got better, and because we detected it earlier,
Early.
you understand, or they detected it early, we're able to treat the patient effectively, and the patient was so happy and thanked us very much. So with that, I was able to recognize the importance of continuous cardiac monitoring.
Okay, thank you.
Yeah. So let's see now. I want to ask let's see. So the person that is applying for a research nurse role, can you tell me what is the day-to-day activity of a research nurse? And also, what do you understand by the research nurse role? Talk. Oh, she, I've kind of known everybody's name now. Are you talking? Because you seem to be unmuted, but we cannot hear you. Or is it network?
I think maybe.
Okay, we can hear you now. So what's the day-to-day activity of a research nurse? And yeah. Oh, second question. Let me read that again. And what do you understand about the research nurse role?
Okay, so the day-to-day activity of research nurse is to assess and monitor the care pathway for participants undergoing clinical trial. And then also she identify, screen, and also recruit participants for clinical trials. She also involved in the recruitment, education, and monitoring of trial. And also she work with the multidisciplinary team to provide to ensure the participants are their safety are maintained. She also work in line with the ICHGCP, which is International Council Harmonization and Good Clinical Practice. And then she also work in the best interest of the research participants to ensure that their rights are upheld. and she also register participants into trial. And then also she also monitor participants during clinical trial for any adverse events or serious adverse events, and escalate promptly to the principal investigator and also the senior research nurse. And then she also updates the senior research nurse about the ongoing clinical trials. And then again, I think that's the roles of a clinical research nurse. And
Well
a
done.
research nurse is
Go on.
who works in the research department to deliver accurate research. I think that's the clinical research nurse that I know. Thank you.
All right, well done. So you've actually answered most of the questions, and that was very good. They help to recruit patients. You could also give example maybe when they're recruiting patients. I don't know if you have any example like having given patients questionnaires, asking if they can participate, or going to ward to see ask patients during clinics if they can participate in clinical trials. You understand? Explaining the studies to the patients, getting informed consent, very, very important, collecting data, monitoring the patient's safety during trials as well, too, working in line with the doctors, research team, the trial coordinators, and all of that. And in case any issues, raise it up quickly, making sure you are documenting, holding meetings daily to update the with the doctors and the research team in regards to the progress of a certain research drug or research program that is ongoing. You understand? Keeping yourself updated with any changes or any recommendation by the NMC or the research team or the world at large in case there's any update in regards to a particular program. So well done. You've done that well.
Right.
Who have I not talked? So, which department have I not talked about now? I'm talking
General
and
medicine.
targeting which one? General medicine. I think I got
Yeah.
plenty question now. That one is many.
So if you want
Okay.
to this one, does it require a example is or a scenario like using the STAR method? When you ask me
So
about the
yes, if you want, yeah, you can like the day-to-day activity. So what you can do is, for example, in what I do currently. So when I resume work, I try to if it's time for medication, I have to make sure that my patient has informed consent. I make sure that they've signed it. I'll make sure the patient understand what we are about to do, and the patient was happy and he had signed the consent to the doctors. I'll make sure that so when I'm also doing administering the medication to my patient, I make sure I keep an eye on my patient's observation just in case my patient has any counter interactions to the medication. I'm quickly going to raise it up with the team. I also make sure to have a good, clear communication with my patients. So make them understand, okay, so why they have been at home, have there been any reactions, or are they still happy with the progress of us to continue? Also at times in my current practice, what else? I make sure that I have a very close relationship with the doctor's research team and trial coordinator, so I can easily relate and escalate to them in case of any issue. You say you are relating it already. I don't know if you understand.
yes, yes.
Yeah, so I like so this is what I do on a daily basis when I'm at work. I also and at times maybe once in a week or twice in a week we do like recruitment of patients. Also, we also give patients survey when we go to the wards to go and ask do they want to do they want to get involved with clinical research? I also work in line with other departments in the hospital. So, for example, let me give this example now. When I was pregnant in the UK, they usually give me like when I come for clinic, they will give me a form and ask me, do I want to engage in research? You understand, for to try out drugs. You understand why I was pregnant and all of that. Some people agree for that. So those are what research nurses do. They collaborate with the midwives and create a form so that the midwives can ask the patients. You understand? So not only are you collaborating with the research team, now you're collaborating with other departments so that to get to recruit patients into clinical research. You understand? So these are things you do, and you can use with different means, either through surveys, either through one-to-one conversations. You understand? So these are different things. I don't know. Did I buttress that?
Yes, yeah. But people want to ask, clinical research nurse and research nurse, they are the same, right?
So clinical research nurse, right? It's not within the clinical hospital. The different research. But I believe you are applying to a trust, right?
Okay, okay, okay,
So it's within the clinical
okay.
area. So it's a clinical research nurse, obviously, that you are doing. Depends on the area you are applying to. That will determine what parts you are, what type of research nurse that you are applying for. So while you are recruiting, other means of recruitment could be. It might not be necessarily you. Like I give you an example now. The research nurse has already collaborated with the other nurses in other departments, maybe giving them survey, giving them paper, or when the patient come, could you please give it to them, working in line with the trust policy, you understand, to get people, recuse people into research and all of that. We can also make them aware of at times if you are if they are doing clinical research, the trust is to give them free parking, make them know of some benefit they could get in terms of research rules and all of that. So these are also ways you can care for your for patients in case they ask you how do you care for patients or go the extra mile for a patient in terms of research. You understand? But watch videos on research nurses. It's quite a very interesting role. Okay.
Okay. Thank you so much.
All right. So the person in a sorry, just give me a second. Somebody say I haven't asked. Is your own medicine or what? Who is the
Yes,
person that said
general
I've not
medicine.
asked question? No. Okay, all
General
right, that's
medicine.
okay, all right, that's fine. So one question I want to ask you is that let's deal with falls because in medical world they used to have lots of falls. So how do you ensure and prevent falls for a patient, especially one that has continuous previous history of falls? A dementia patient, by the way. Are you not here again?
Yes, I'm here.
I've
I'm
asked you a
here.
question. I'm waiting
Okay.
for your reply.
Okay.
How do you prevent falls for a patient that's a dementia patient that's fallen multiple times in the world? What will you do? Because that's a very common situation in medicine world.
Okay. To ensure that I mitigate this fall, I'll be following the fall precautions, and which includes ensuring that because at first my patient is my priority, and to ensure the safety of my patients, I'll do risk assessment to identify. I've already identified that, oh, this person is a dementia patient. Sometimes they can be confused, so I will do risk assessment firstly, using the tools like is it fall scale to identify
For
patients that are risk, like this dementia patient right now. Then secondly, I will ensure environmental safety. Make sure that I use either low bed, or if necessary, um the rays are raised, or I put the patient on a low bed. I'm going to ensure that there is call bell usually available at the patient's bedside, making sure that this bell is within the reach of the patient in case they need anything. I would also ensure that there is enough lighting for these patients. This is ensuring environmental safety. There's enough lighting for this patient. Okay. Thirdly, I would ensure that there is frequent supervision. Just like this, I will put this false alerts on the patient bedside, because this patient is always at risk. So I'll make sure there is a four alerts at the patient bedside, and also frequent supervision by always frequently observing that the patient that is at risk, this particular dementia patient. I would also encourage patients to ask for help. For example, they might want to mobilize. So through the use of call bell, they can ask for help as well. Then I would go ahead to review the patient's medication, because sometimes the fall could be from the side effects of a particular, maybe there are any antipsychotic medication. So it might be from the side effects from this medication. So I would review this medication. For sometimes it could be that this medication makes them weak, it makes them sedated, or it makes them dizzy. I would review this medication and liaise with the doctors or the pharmacist about the fall risk increasing drugs, because probably these drugs increases their risk of fall. So I'll review the medication. Then I would also um I also educate my patients and the family as well. Teach them on about safe mobilization techniques, and also encourage them to help the patients with, with mobilization. They should also support the patient with assistive aids, like things like their crunches, their wheelchair, to assist them with it so as to prevent further fall. If this patient uses glasses or hearing aids, they should also ensure that this patient is always on it in order to prevent fall. And also, I will explain to them on the importance of assisting my patient as well. Then I'll also educate them on post-fall protocol. All right. Even after a fall occurs, you would need to assess injuries immediately. For example, when this patient keep on falling, at first, depending on the height of fall, you don't immediately move the patient, because there might be risk for fracture or any further injury. So you first assess for any injury immediately, and then escalate or call for help, and also do check the patient vital signs. Once you've rectified there is no further deterioration, you can now go ahead to do the vital signs and monitor the patient. So at the end of the day, after the fall, I will go ahead to document all the interventions and everything that was done to the patient. Make sure that this documentation is dated, it's signed, and I would also go ahead to write an incident report concerning the situation following my hospital protocol. I write an incident report on what happened, the reason for the fall, what and through this, it will help during the handover in order for us to review the patient and provide an individualized care plan for this patient in order to reduce the risk of falling. Thank you. Oh my Jesus.
Okay. You've done well. Why do you say, oh yeah, Jesus? Do you think that you've talked a lot? You've done you've done well, okay. You've covered everything. I don't even think there's any other thing I'm going to add.
Sorry, please. I have an addition, please, and I have
Okay.
a correction.
Okay.
First thing, the answer she actually did so well, but I think the answers are too lengthy. Then aside that, you didn't I'm thinking you're supposed to have a scenario on how you are able to help a patient that has been falling frequently
Yeah, she
within the
should have
unit. What
added
you
that as
did
well. So
using that star approach at the back. So me, I would just advise maybe you can just list like 5 points at the what you can do to help the patient, like you said, lightning, walking aids, family support, and all. You can just leave that maybe few points at the beginning, explain what you would do, like what you did now. Then you now put a scenario at the back using that star approach on what you did, the result of your
yeah,
action, how you're
yeah.
able to help that patient to prevent further falling. So that's my own observation.
And when you do that as well, all these things that you've said will enter inside it and kind of complete, but
Yes,
then it will make them
definitely.
see it that you've actually done it as well. So
Yes,
yes,
yes.
Thank
you've
you.
done well. You've
Thank
done
you so
well,
much.
100%. But you can see after you finish talking, you have to take a deep breath because you spoke for quite a long time. But just like she has advised, you've talked about environmental safety, which is the lightning, wearing the patient's slippers, speaking with the family, just like 1 to 5 point, then you can buttress it into example, like what you did And when I did the example, all these many things that you said, we just push it in. You see that you talk about what you did, and when you're giving example, everybody like gossip. Or me, I like tatafo. So when you're giving example, it's like you are gossiping. You are gossiping like, so this was what I did when I had a patient that I've had situation like this, and my patient kept on falling, all of that, and this is just what I did initially when he fall, bringing in that post for something now, and then also the other false technical. So it makes them know, oh, this person is good. You understand? Because you've done it before, and they don't start teaching you what to do. Yeah, that's right. So there's a way you be so good that even your trainings after they have to give you the job, although they're supposed to give you good long training, no, they can just shorten it because they say this person is good. You now have so much training person on the game. So it happens like that. But it's so good for them to give you good full training, no, so that it's not like as if they think you know some things now, you might not know that thing at the end of the day. But yeah, I think that's it. So we spent 2 hours on this interview. I've covered, especially for those people that spoke, especially when you tell me about yourself questions. I've covered most of some of your topics, and I've asked you at least one question to balance it all. But like I said, you will really benefit from having a personal one-to-one session. And for those people that I did not reach, I did not talk, we did not have a conversation like the maternity, the one-to-ones. I was calling you guys, but nobody spoke. I did give, if you listen to the very first part of the interview, I spoke about some things that you need to read and review. I also talk about generally. Before I went specific, I talked about generally. I made emphasis on deterioration, prioritization, conflict management, falls, pressure, self prevention, control, trust values. I made mention of safeguardings, right? And then I went specific to talk about each of your departments and stuffs to review and all of that. So thank you everybody for today. I'll be calling the interview session to an end. Thank you so much for giving me your time, and thank you so much for participating. It was actually a beautiful and a very interesting interview session. Thank you.
Thank you.
You
Thank
too. We really appreciate your time. Thank you
Thank
very
you
Thank
much.
so
God
you.
much.
And
bless you.
I hope it was very good for you. Thank
Yes,
you
it
so
Yes,
is.
much.
yes, it was. Thank you.
Thank you. Thank you so much then. All right.
Thank
Bye.
Thank
you.
you.
And don't
Ah,
forget to when you
let
finish
us
your
meet your baby.
interview, when you finish your interview, please post your questions because it's going to help everybody. Please don't start saying you want to hold your question. We did not ask you for your name, so it's fine. Just your questions, it's okay, so that we can post it on the interview group and everybody can learn from it, right? So when you help people, you are being blessed. So he that gives gets more. Thank you so much, everybody. Bye bye.
you.